Welcome to Shanu's Media Education Nursing Officers YouTube channels. Before we have discussed critical care nursing test paper 3 part 4. Today we are discussing part 5. So this is a very important session to all nursing officers who are preparing for the central government and state government examination, and along with the international also. These questions are very important to prepare. So don't skip the video. Please watch the till the end. So coming to the topic, the question number 1. A client is admitted to the hospital with diagnosis of myocardial infarction (MI) and is going to have a intravenous nitroglycerin infusion started. Nothing that the client does not have a intra-arterial monitoring line in the place. What piece of the equipment should be the nurse obtain for the use at the bedside? The option A is defibrillator. The option 2 is pulse oximeter. Option 3 is non-invasive blood pressure monitor. The option 4 is central venous pressure CVP incision tray. The correct answer is option 3, non-invasive blood pressure monitoring. The explanation of this question: nitroglycerin diabetes both arteries and veins, causing a peripheral blood pooling, thereby reduced to preload, afterload, and myocardial work. This also accounts for the primary side effect of nitroglycerin, which is hypotension. In the absence of continuous direct arterial pressure intra-arterial monitoring, the nurse should be used for automatic non-invasive blood pressure monitor. The remaining options are not specifically associated with the administration of the IV nitroglycerin. The question number 2. Fetal distress is occurring with the laboring client as a nurse prepares the client for the cesarean birth. What is the most important nursing action should be? The option A is slow the intravenous flow rate. Option 2 is continuous the oxytocin drip for infusion. Option 3 is place the client in the high follows position. The option 4 is administer the oxygen 8 to 10 liters per minute via face mask. The correct answer is option 4, administer the oxygen 8 to 10 liters per minute via face mask. The explanation of this question: oxygen is administered 8 to 10 liters a minute via face mask to optimize oxygenation of the calculating the blood. The option 1 is incorrect because of the intravenous infusion should be increased per primary health care provider prescription to the increase the maternal blood pressure. The option 2 is incorrect because of the oxytocin stimulation of the uterus is discontinued of fetal heart rate patterns change for any reason. The option 3 is incorrect because of the client is placed in a lateral position with her legs and raised to increase maternal blood volume and improve the fetal perfusion. The question number 3. The emergency department nurse is preparing to administer the famipizole to the client suspected of have ethyl glycol antifreeze intoxication. The nurse obtained the vial of the medication and note that the medication has solidified. Which action should be the nurse take? The option A, discard the vial. Option 2 is run the vial under the warm water. Option 3 is contact the primary healthcare provider, and option 4 is call the pharmacy and request another vial of the medication. The correct answer is run the vial under the warm water. The explanation of this question: famizole is used in the treatment of known or suspected ethyl glycol antifreeze intoxication. It is administered via the intravenous route. It is diluted in the last 100 ml of 0.9% normal saline or 5% dextrose in water and administered over the 30 minutes period. If the medication solidified in the vial, the nurse should run the vial under the warm water. The remaining options are inoperative or unnecessary actions. The question number 4. The nurse is caring for the client with the chest tube drainage system. During the repositioning of the client's the chest tube accidentally pull out the pleural cavity. Which is the initial nursing action should we take? The option 1 is apply an occlusive dressing, and option 2 is reset the chest tube quickly, and option 3 is contact the respiratory therapist. Option 4 is contact the primary healthcare provider. The correct answer is apply the occlusive dressing. The explanation of this question: if the chest tube is accidentally pulled out, the nurse would be immediately apply the occlusive dressing and then contact the primary healthcare provider. It is not appropriate and note the nursing role to the reset a chest tube. It is not necessary to contact the respiratory therapist. The primary healthcare provider need to notify, but this is not a initial nursing action. The question number 5. The nurse is making initial rounds at the beginning of the shift and note that the parental nutrition bag of the assigned client is empty. Which solution should be the nurse hang until the another PN parental nutrition solution is mixed and delivered to the nursing unit? The option 1 is 5% dextrose in water, option 2 is 10% dextrose in water, option 3 is 5% dextrose in ringer lactate, and option 4 is 5% dextrose in 0.9% sodium chloride. The correct answer is 10% dextrose in water. The explanation of this question: the client is at risk in hypoglycemia, therefore the solution containing the highest amount of the glucose should be the hung until the new PN solution become the available. Because of the parental nutrition solution contains high glucose concentrations, the 10% dextrose in water solution is the best of the choices presented. The solution selected should be the one that minimizes the risk of the hypoglycemia. The remaining option will not be effective in minimizing the risk of the hypoglycemia. The question number 6. The nurse is caring for the client who is sustained a burn injury to the anterior arms and anterior chest area from the fire. Which is the assessment finding would be the indicate that the client is sustained a respiratory injury as will result of the burn? Option 1 is fear and anxiety, option 2 is complaint of the pain, option 3 is clear breath sound, option 4 is use the unnecessary muscles of the breathing. The correct answer is option 4, use the accessory muscles for the breathing. The explanation of this question: clinical indicators of the respiratory injury in burn injuries client include the presence of the facial burns, the presence of the shoot around the mouth and nose and single nasal hairs. Signs of respiratory difficulty include the changes in respiratory rate and the use of the accessory muscle for the breathing. Although the anxiety may be sign of the hypoxia and anxiety along the bradycardia and dysarrhythmia and lethargy would be more likely to indicative to concern related to the respiratory injury. The abdominal breath sound and abnormal anterior blood gas value also would be the noted. The question number 7. A client has just undergone the insertion of the central venous catheter at the bedside. Under the ultrasound, the nurse should be the sure to check the which result before initiating the follow rate of the client intravenous solution at 100 ml in hour. The question number 1, option number 1, serum osmolality and serum electrolyte level. Option 3 is intake and input records. Option 4 is chest radiology results. The correct answer is chest radiology results. The explanation of this question: before beginning administration of an IV solution, the nurse should be access the whether the chest radiology result reveals that the central catheter is the proper place. This is necessary to prevent the infusion of the fluid into the pulmonary and subcutaneous tissue. The other options represent items that are useful for the nurse to be aware of the in the general care of the client, but they do not rate this procedure. The question number 8. An ultrasound is performed on the client at the time gestation who is experiencing moderate vaginal bleeding. The result of the ultrasound indicates that absorption of the placenta is present on the basis of the finding. The nurse should be prepare the client for the which anticipated prescription. Option 1, delivery the fetus, and option 2 is stick the monitoring of the intake and output. Option 3 is complete bed rest for the remaining of the pregnancy. Option 4 is the need of the weekly monitoring of the coagulation studies until the time of the delivery. The correct answer is delivery of the fetus. The explanation of this question: absorption is placenta is the premature separation of the placenta from the uterine wall after the 20th week of gestation and before the fetus is delivered. The goal of the management is absorption. Placenta is control the hemorrhage and deliver to the fetus as soon as possible. Delivery is the treatment of the choice of the fetus is term gestation or if the bleeding is moderate and severe and client or fetus in the geopardy. Because of the delivery is fetus is necessary, option 2 and 3 and 4 is incorrect. Regarding the management of the client with absorption of the placenta. The question number 9. The nurse is documenting the information and a client chart when the electrocardiogram telemetry alarm sounds and the nurse notes that the client is in ventricular tachycardia. The nurse rushes to the client bedside and should be perform which assessment should be the first? The option 1 heart rate, option 2 blood pressure, option 3 respiratory rate, option 4 check the responsiveness. The correct answer is check the responsiveness. The explanation of this question: the ventricular tachycardia is associated with the significant decrease of the cardiac output. The assessing for the unresponsiveness determines the whether the client is affected by the decreased cardiac output. Therefore, the first action is to determine the responsiveness of the client. Then the nurse should be the check the client is pulled to the determine the next treatment or strategy. The question number 10. A client is receiving the total parenteral nutrition TPN through the single lumen central venous catheter. He is scheduled for the receive antibiotic by the IV route, which is the action by the nurse appropriate before the hanging at antibiotic solution. The option 1 is ensure the separate IV access for the antibiotic, turn off the solution for the 30 minutes before administering the antibiotic. Option 3 is flush the central venous line with 60 ml of normal saline before giving the antibiotic. Option 4 is check with the pharmacy to be sure the antibiotic can given through the TPN solution line. The correct answer is ensure the separate IV access for the antibiotic. The explanation of this question: the TPN solution, total parenteral solution line, is used only for the administration of the solution. Any other IV medication must be run through the separate IV access site. Therefore, the remaining options are incorrect. Okay, thank you for watching Shanush Medi Education for Nursing Officers YouTube channel. Today we have discussed Critical Care Nursing Test Paper 3 Part 5. For more test papers and question papers, kindly follow my YouTube channel and like, share, subscribe my videos for more updates. Thank you very much.